Hello to everyone that's on already. We're going to give it a few minutes to allow some participants more time to enter, and we'll get started in a few. Okay, well, welcome everyone. I'm Christine Storm, the Director of Community Education at Caron Treatment Centers. I want to thank you for joining us after a 2-week hiatus as we resume our webinar series, A View from the Mountain, Caron's Perspective on Addiction Treatment in the Wake of COVID-19. This is our 10th webinar in the series. Today's presentation is eligible for 1 hour of social work continuing education credit. We would like to thank our educational sponsor, Jumana Grassi, for assisting in obtaining these credits. Please keep your Zoom session open at the end of the presentation to access the post-event evaluation to obtain your 1 hour credit. In order to receive your credit, you must stay on for the duration of the webinar, and a certificate will be emailed to you from Jumana within the next 2 weeks. As a reminder, we will be conducting this session in webinar format, so all participant microphones will be muted. During the presentation, please utilize the Q&A feature to ask any questions you may have. And depending on the volume of questions, if we can't get to your question before the end of the hour, we will have someone from our team follow up with you directly. So today's topic is one that's very important to me. I work in the world of prevention and early intervention at Caron with youth, and teen vaping has really taken over as a priority in recent years. Schools are confiscating these products regularly, parents are worried about the health impact, and teens can find themselves quickly addicted and in need of support. The Student Assistance Program at Caron has a large focus on nicotine use prevention and cessation. We offer in-school and at this time virtual cessation support groups, as well as prevention lessons, parent and professional trainings. And this past fall, we launched a few digital learning courses as well. One is called Connect 5, and it's a cessation experience for teens and it helps to walk kids through either reducing or quitting vaping and other tobacco product use. And we also have an educational course for parents and professionals called Vaping and Marijuana Trends. So with all of that being said, I am as eager as you all are to learn more from Dr. Drosnes in today's presentation. And it is now my pleasure to introduce today's speaker, Dr. Dean Drosnes, who is the Medical Director at Caron, Pennsylvania. He is board certified in addiction medicine through the American Board of Preventative Medicine and the American Board of Otolaryngology, Head and Neck Surgery. He is a fellow of the American Society of Addiction Medicine and serves on the ASAM Physicians in Training Committee. He is also a member of the American College of Academic Addiction Medicine, the Pennsylvania Society of Addiction Medicine, and the Alpha Omega Alpha Honor Medical Society. He holds an appointment as Clinical Assistant Professor of Psychiatry at Penn State University College of Medicine. And Dr. Drosnes has served as a medical expert in many of those digital learning pieces I talked to you about before on the topics of marijuana and vaping use. In April, Dr. Drosnes shared his expertise with U.S. News and World Report in an article entitled, "Does Smoking and Vaping Make Coronavirus Worse?" So welcome, Dr. Drosnes.
Good afternoon. I was listening to Christine introduce me, and she froze. So I'm hoping that you can see me and hear me all right. If anybody puts an acknowledgement of that up on a chat on the Zoom room, I would appreciate that. So I'm hoping that you're hearing me okay. Thanks so much, Christine, for the introduction, and thanks so much for to everyone who's on the webinar today for taking part in this activity. This issue of vaping, if you remember, if you turn the clock back to prior to the outbreak of COVID, which first started to hit our media in late December of 2019, and then just rose and rose and rose in its priority until the present day, we were talking about significant illness related to vaping. And prior to that, that was actually, that had reached its peak back in September of 2019. And prior to that, there was an ongoing conversation about vaping and its popularity, its growing popularity, the significance of vaping in young people, and its questionable effectiveness in helping people who were using electronic cigarettes to try to stop smoking. So I'm going to go back. I'm going to try to run through some of that as a reminder for many of us, and just say, hey, where are we now in June of 2020, when for the last 6 months, our focus has really been on COVID and how that's affecting people with substance use disorders, which it has in myriad ways. So just to go back, and I think 2020 is a good place to start vaping in 2020 here. So the whole idea of electronic cigarettes, or e-cigarettes as they are known in the industry, came about as an alternative to tobacco as a delivery system for nicotine. And perhaps they weren't marketed quite that way, I'll just say it in those terms, but that's exactly what it was. It was an alternative delivery system for nicotine, which was previously found in tobacco. And the industry spent many years developing sophisticated equipment to enable people to get nicotine without imbibing the tobacco, which had a lot of ingredients put into it that was unsafe. So early on, nicotine in an outside of tobacco form was developed into a liquid, a vape liquid, and was utilized through e-cigarettes, or what we call vape pens. There are many, many types of these now. And this was pretty successful. At the time, the marketing was pretty robust in terms of claiming that vaped nicotine was much, much, much healthier than using tobacco, to the point where some manufacturers were claiming that it was harmless water vapor. We found since that time that that was not correct. One of the consequences of developing this delivery system, this electronic delivery system, was that people who wanted to use THC found ways of concentrating THC into a liquid form and selling pods, which is a common name for the disposable liquid inserts into the vape pen. And so people were able to substitute THC-containing products for the nicotine-containing products. Some people on the black market were manufacturing both, so you could smoke your nicotine and your THC at the same time. There was a good deal of concern about the popularity of this delivery system in young people, and of course the anti-nicotine folks as well as the anti-THC folks made a big uproar about how marketing was focused on young people. So as a result of that, marketing turned toward flavored liquids, which actually turned out a flavored water vapor without nicotine or THC. And this remains controversial because, you know, to say somebody, hey, get this strawberry flavored liquid and you can use it in your vape pen is a very minuscule distance away from using nicotine or using THC with the same flavorings. So this has become a big topic of controversy. At one point in the distant past, I would say within the last 6 months, there was a question as to whether or not flavored liquids without any nicotine or THC should be banned. And if I remember correctly, the decision was made at the last minute not to ban these flavorings. So they're still out there. People are still using them. What did get changed, however, was the very, what do I want to say, bright and shiny marketing that went along with the flavoring. So they're not directly marketing, obviously, to kids at this point, but that's where that stands. And next slide. Yeah. Next slide, please. Thank you. So the question of whether or not vaping does offer a benefit over smoking has been talked about since vaping first came out. So I want to really stick to the facts as they are supported by the scientific research rather than opinion, which is in every different direction when it comes to vaping versus smoking. But if you look at the science, what we can say is that vapor, what comes out of the vape pen that is inhaled, has fewer harmful ingredients than does cigarette smoke. But vapor does not just contain water vapor, as was previously claimed by the manufacturers. There is a lot of ingredients in the inhaled vapor that are not healthy, and I've listed a few, but not all of them on this slide. So of course, nicotine, not always nicotine, as I mentioned, because some of these products are nicotine free, but nicotine certainly is the reason that most people who vape. There are what are called ultrafine particles, and we actually don't even know what these ultrafine particles consist of because they're so fine that you can't really capture them and put them under the microscope and take a look to see what's in them. There's some suspicions, but I don't want to get too deeply into the science. There are heavy metals. Part of the electronic cigarette device, which I'll talk about in a few minutes, is a tungsten coil that heats up, that causes the liquid to vaporize, and that's what the people draw into their mouth. But the heavy metal in the process of heating up actually disintegrates a bit. So people who are using these things are actually inhaling minute particles of heavy metals, which can do significant damage to the lungs as well as the upper aerodigestive tract. There are volatile organic compounds. Volatile organic compounds are known in many cases to be carcinogenic, and these are probably products of some of the diluents that are used to dilute and liquefy the nicotine. So these are also inhaled as well. And then a specific compound called diacetyl is a flavoring. It's actually a flavoring carrier that is known to cause lung disease. So these are all ingredients that are actually unique to vaping. Some similar ingredients are in cigarette smoke, but these ones here I listed here are really unique to vaping. They're not healthy for the lungs. And once the reports started coming out about the inclusion of these elements in the vape smoke, there was a lot of attention turned to the safety of vaping versus smoking. So we'll talk about that some more. Next slide, please. So that leads to the question is, well, is vaping ever beneficial? And this is the question that keeps coming up. Many people say, you know, it's a substitute for cigarettes, so it's obviously better than cigarettes. Other people say, well, you know, if it contains all these other substances, it's no better than cigarettes. So the science behind this whole vaping movement, I'll say, is that vaping, when substituted 100% of the time for tobacco smoking, in other words, the person who is quitting smoking uses a vape product instead of tobacco 100% of the time, is less harmful than smoking, and may be an effective means to help complete smoking cessation. So hypothetically, vaping can be beneficial to help somebody quit smoking, but they can't smoke and vape, and their goal must be to achieve complete abstinence from smoking. The real world studies that have been done investigating this have shown that the majority of people who utilize a vape pen to help them quit smoking tobacco, if you look at them at the end of a period of time, often it's 3 months, maybe 6 months, maybe a year, the studies show that most people are doing both. They're smoking cigarettes as well as vaping. Now, they may be using vaping indoors or in places where smoking isn't allowed, but vaping is. And in some cases, it probably accelerates the nicotine addiction. So, you know, this is what the difference is between real world research versus hypothetical science laboratory-based research. You know, the real world is not as pure as a study environment is. So this really applies to vaping. So is it ever beneficial? It may be. Is it usually beneficial? It does not appear to be usually beneficial. So that's really where we stand in terms of vaping. Now, there are studies, don't get me wrong, there are studies that demonstrate that some people do succeed in achieving a smokeless, a nicotine-free life through vaping. So for those people, it's a helpful technique. Next slide, please. So as I alluded to earlier, back in 2019, in the fall, I think it was, well, it started actually probably around this time last year. There were some reports of people who had very severe lung disease, and it was thought to be related to vaping. And if you remember, throughout last summer, there were increased numbers of cases of this vaping-related illness. That was a mystery, and the CDC got very much involved, and there was a lot of controversy about vaping and what was causing the illness. And so this illness got to be known as EVALI, E-V-A-L-I, and that stands for electronic cigarette or vaping-associated lung injury. But we call it vaping-related lung illness. This is what the CDC first called it. And there were a number of different reports based on the time. The number of cases reached its maximum in September of 2019. And what happened was that there were some suspicious elements of what people were inhaling that were investigated by the CDC. So just to kind of recap what happened, by February 18th, 2020, we were already knee-deep in COVID, so we weren't paying a lot of attention to this. There were a total of 2,807 lung injury cases associated with vaping in the United States. That's quite a bit. And there were 68 deaths, that was in 29 states plus the District of Columbia. And of course, what was done at that time from an epidemiologic standpoint was, well, where are the products coming from, who's manufacturing them, where are people buying their supplies, contact tracing, et cetera, et cetera. And what was found was that most people who had vaping-related lung illness had been using THC containing products. Not everybody, but most people were using THC containing products. So the question is, was this a THC related illness? And the answer to that turned out to be no. And then when they looked again at the epidemiology, they said 70% are men, 76% of the people that got this disease were under 35 years old, 15% were under 18 years old, but 37% were between 18 and 24. So it seemed to be preferentially hitting young people with a significant concentration in teens. So this was really why this became such a big deal, what's happening with these teens, in view of the fact that these products were so pleasing and attractive for teenage use. And next slide, please. So again, this illness was named EVALI for e-cigarette or vaping-associated lung injury. And what turned out to be the case was that there was vitamin E acetate found in the lungs of most but not all cases. And my personal opinion, and don't take this as science, but my personal opinion is that in the cases where it wasn't found, they just, it was a geographic miss, so to speak. In other words, when they did the lavage of the lungs to get the lung fluid, they just didn't get any vitamin E acetate. But the vitamin E acetate was added to a solution that contained the THC in some commercially but illicitly marketed products. So it was in the manufacture of these THC cartridges that were sold for vape pen use, where the vitamin E was concentrated. And once that was found and the distributors of these products were found, the illness almost disappeared. We occasionally see cases of vaping-related lung illness related to vitamin E acetate, related to THC use, and it's probably just some remnants of the old produced products that are still out there and being utilized by some people. So the question came up in the early parts of the COVID-19 epidemic of whether vaping was related to COVID-19. And I will talk about that going forward. But we've not seen any, or at least I was unable to find in the medical literature, any reports of co-occurring EVALI with COVID-19. So we really have nothing to go on as far as, you know, investigating somebody that has both of these diagnoses simultaneously. So next slide, please. All right, so just to review, or maybe you've never seen this before, but looking at parts of an e-cigarette. I don't know if you can see my pointer when I put this on the slide or not, but I'm gonna just say, so at the end of this device, there's a battery, and sometimes there's a little light to light up when somebody draws on the mouthpiece, and it kind of looks like the end of a cigarette, or a lifelike look, I guess. And then there is a switch with a diode that when it's pushed, activates the microprocessor and the heating element, which is here, so that starts the heating element heating up to very, very high temperatures, and heating the heating element then ignites the liquid, and you get, instead of liquid, you get vapor. You get a boiling vapor. And then it cools a little bit as it goes through the mouthpiece, and then the person inhales it. And so the cartridge here holds what they call the juice. So just going from right to left on your slide, I kind of went through the elements of the electronic cigarette. Now in the cartridge is where the either nicotine containing liquid or the THC containing liquid or the flavor containing liquid, or parts of all of them, are contained. And that's where the vitamin E acetate was actually found in the EVALI related products. So the person draws on the mouthpiece, ignites that liquid, turns into a vapor. The vapor is drawn into the mouth. And I'll just give you another little point here, a piece of somewhat trivia, but I think is quite important. Many of these devices have a governor on them so that when somebody heats up the liquid in the cartridge, they can only draw for so long a period of time before the device stops. In other words, it just will stop after a period of time because you don't want somebody to overdose, by taking such huge draws off the cartridge that they're going to get an enormous amount of nicotine. One of the effects of the vape pen is that the nicotine is not as harsh on the mouth and throat as tobacco is when it's inhaled. And what youth were doing in cases is they were buying 2, 3, 4 of these and smoking them or using them all simultaneously. So they would draw off of one. When it stopped burning, they draw off of another one. Then they draw off of a third one. They draw off of a fourth one. And by that time, the governor would allow them to start drawing off the first one again. And we actually saw people overdosing on nicotine, which caused significant cardiovascular problems. Now that obviously is not an intention for the way this is used, but it was an unintended consequence. So, again, what we know from treating addictions, and I'll say this very bluntly, is that if there's a way to use a product to get more of what you're getting from it, people will find a way to do that. And they've done so with electronic cigarettes. Next slide, please. So then, is vaping safer than tobacco smoking? And as I mentioned before, if in a certain situation where a person gives up tobacco altogether and uses vaping as a means to achieve complete abstinence from tobacco or smoking, then the answer is yes. But I just want to point out this study. This was a study, did not get a whole lot of press, but this came out last October. And it was a study done looking at electronic cigarette smoke. It's not really smoke, it's vapor, as we talked about, in mice. And what the authors found, and I'll just cut to the chase here, was that e-cigarette smoke is a carcinogen in and of itself. And nicotine is also a carcinogen. And this is the first time that anybody has ever shown that nicotine, in the absence of other products, acts as a carcinogen. And there's another breakdown product of nicotine called nicotine-derived nitrosamine ketone, which is also a carcinogen. So this is, I'm sure, being investigated as we speak, but this caused both lung cancer and precancerous lesions in the bladder of mice. So this is going to be very important because, we have not associated directly vaping with cancer in humans, but this is where that kind of investigation starts, by looking at animals and what their effects are there. So next slide, please. All right, so what we know is that vaping injures the lung. I'm trying to just tie this together. I hope I'm succeeding. Vaping injures the lung. The aerosols that are produced by these vape pens damage the pulmonary epithelial cells. These are the cells lining the lungs. They damage these cells directly, and that causes these cells to break open and empty their contents out and cause inflammation in the lungs. And the other thing that it does is it reduces the lung's ability to fight infection, because there are anti-infective compounds within the lung cells themselves that are brought to bear when an infectious element hits the lungs. So if you vape, you're damaging your lung tissue, and your ability to fight infection is reduced. So that's condition number 1, I'll call it. Condition number 2 is if you acquire COVID-19, and COVID-19 causes direct lung damage by the coronavirus itself. So when the lung cell damage by coronavirus is mild. People get a cough and they have a lot of secretions and they spit that out and it goes away after a few days. And people recover just like they do from other virus infections. But when it's severe, it actually leads to pneumonia, much more severe lung tissue damage. And that can lead to what's called adult respiratory distress syndrome, which is when people are unable to clear fluid out of their lungs and the fluid interferes with oxygen being taken up by the lungs. So what happens is people try to breathe, but it's not effective in oxygenating the body. And those are people who end up on a ventilator in the hospital, and many of those people unfortunately do not survive. So these are two different effects on the lungs, but nevertheless, they're similar in many respects. Next slide, please. These are various CT scans or CAT scans of people's lungs. This is the, I guess, the front is at the top, the back is on the bottom, and the right side of the person is on the right, and the left side of the person is on the left. It is as if they're looking up, right? So what we see on the bottom left slide is probably the best one to look at this. If you look at that, I'm not sure how well you can see that, but you'll see that there are some bright white dots throughout the lung. The lung is kind of dark, right? Those are the lung. The area, and the big round area in the middle is the heart and the great blood vessels, but the lungs are the darker shaded area. You'll see some white spots in there, and that's the blood vessels in the lung. But you also see that there's a couple different tones of gray in that in those pictures. And what we call that is a ground glass appearance. It's as if somebody took a bunch of glass and ground it real fine and it sprinkled it all throughout the lungs. And this is damage from EVALI. This is damage to the lungs caused by vaping-related lung disease from vitamin E acetate. And I don't expect anybody to be a radiologist, but I want you to compare that bottom left slide with the next slide, please, which is also showing the lung. And you can see that similar difference in gray tone, ground glass appearance. And this is COVID-19. This is a photograph of, of a CAT scan of a patient with COVID-19, and they're not all that terribly different. So the damage that is caused by COVID-19, which is this severe interstitial pneumonia, oftentimes leading to death, is not too dissimilar to the damage that's caused by vaping-related lung illness in the people that got that. Now, I don't mean to point out this similarity as a cause and effect relationship. That's really important because there was some commentary. I think our Surgeon General may have been one of the ones that mentioned this several months ago as to whether or not people who vape were people who were getting COVID-19. So I want to just end this talk by just explaining the relationship as I see it. So next slide, please. So what's the relationship between vaping and COVID-19? So COVID-19 is a viral infection that primarily affects the lungs. People who have COVID-19, in scientific studies, for people who had COVID-19 who had any chronic respiratory disease prior to obtaining COVID-19, their case fatality rate, that means the percentage of people who got the disease who died, was 6.3%. But if you didn't have any lung disease in this particular study before you got COVID-19, the case fatality rate was only 2.3%. So three times greater likelihood that you would get, that you would die as a result of COVID-19. Another study from China, looking at some of the original patients who got COVID-19, showed that patients who contracted COVID-19, there were 14% of those patients who deteriorated, and that means that they went on to require a ventilator support, and approximately 6.3% of those patients died. And of those who deteriorated, 28% were smokers. But the 86% of that cohort of people improved, and only 3% of that group were smokers. So again, both of these pieces of data really support the fact, and next slide, that the take home is, from what we understand, is that we cannot unequivocally claim that vaping makes a person more susceptible to COVID-19, or that the disease is going to be worse in every case. However, people who smoke or vape have a much higher likelihood of developing more severe COVID-19 related lung disease. And that's really the take-home message. So what I say in response to that, I don't know if you have it on the slide or not, but my response to that is that, number one, the only possible benefit to vaping is if it leads to complete cessation of nicotine. That's the only time it's ever beneficial. And number two, studies have not shown vaping is effective in nicotine cessation. And number three, which I just talked about, is the fact that if you are a vapor or a smoker and you get COVID-19, you're much more likely to get much sicker. So all of that to say, this is the best time for people to quit vaping or smoking. So I thank you for your attention, and I'm happy to take questions.
Thanks so much, Dr. Drosnis. I found the information about all the health impact and the clarification of COVID-19 and vaping and that relationship to be very helpful. So we have a couple of questions that were submitted during the registration process that we will go through now. And the rest of you, if you have questions, can continue to put those into the Q&A feature. And if we have time, we will answer those as well. So the first one is, if you could just clarify, I think you addressed this, but maybe just clarify this a bit more. Is it true that vaping causes more immediate health issues than cigarettes do?
Well, so my belief is that that question addresses this e-cigarette and vaping associated lung injury that we saw last year. And in those cases, absolutely. I mean, people were developing lung injury, lung effects, severe lung disease within weeks of beginning e-cigarette use. So in that respect, smoking does not cause a similar type of reaction. Both of these products will cause long-term lung injury, but the vaping has been associated with a more immediate effect due to these vitamin E acetate. Whether that's going to, whether we're going to see another injury or lung problem in place of that relationship, just time will tell.
Right, right. So I know when I'm working with youth that are vaping, sometimes they are talking about mouth sores that won't heal, getting tonsillitis over and over again. So those are things that I didn't always see with kids that had started smoking. So is that something that's just a little bit different?
Yeah, actually, you're drawing on my otolaryngology knowledge, and that's fine. I haven't forgotten too much over the years, but yeah, I mean, these products are irritants, and whether it's nicotine, nicotine is an irritant in and of itself, also a carcinogen, as I just mentioned, but tobacco smoke has been, what do I want to say? They have played with it over the years to make it less irritating and more appealing. And they didn't have to do that so much with vape liquid, because vape liquid is water-based, right? So it's, it doesn't feel as irritating to the oral mucosa, but the compounds, the volatile hydrocarbons, the minute particles that are in there can be irritating and definitely cause mouth irritation. As a matter of fact, there is a study, and I can't remember exactly where it came from, but recently published showing that kids who are vaping are having precancerous lesions in their oral cavity. So yeah, it's dangerous stuff, and more will come out as it's being investigated more. But it definitely is it's not an alternative that's acceptable for kids, and the excuse that, well, at least it's not cigarettes, is just no longer acceptable excuse.
Right. Okay. One of the questions was related to, is it easy to order vaping products online?
Extremely easy. I think there's an age verification page that people have to fill out. I don't think that there's any way that they can check on that, but all you have to do is say, yeah, I'm over 18, you can order to your heart's delight. I mean, there's dozens of them out there, and so it's very easy.
Yeah, and I
In
think
some
now
states,
that
in some
kids are
states,
stuck at home.
yeah, in some states, I think vaping products were actually listed as vaping distributors were listed as essential businesses. So
Okay.
take that at face value.
Yikes. Okay, another one. How often are kids putting other substances into vape pens like marijuana?
Yeah, I don't think it's easy to know. I mean, we certainly don't have published studies of that. That may come out in the next Monitoring the Future study, which looks at school-age kids and what they're doing. But I don't think a lot of people are going to be 100% honest about that. What I know is that part of the reason that vape products are so appealing to young people is that they can use THC products very easily. There's no smell to these oils. It's much more discreet than smoking marijuana in marijuana cigarettes. The other thing that's appealing to some people is that you can get extremely high concentrations of THC in a liquid that is smoked through a vape pen. So I don't know the number of how often. It's very frequent.
Yeah, and I know that you can manipulate some of the pod-based devices to put THC liquid in, but for the most part, what I'm noticing with kids is that they buy pens that are specific to have THC cartridges put onto them and then vaped. So great. There's another question that asked, how do you get teens to quit vaping? And I'm happy to tackle this one since that is certainly within my world. So I work in school systems, and teachers and schools are left and right confiscating vaping devices, and we host presentations where parents are coming up saying, I found this, does this mean my child is vaping? So the first question that I always ask is, we need to assess their level of dependence. So if the young person is saying that they've built up quite a tolerance, they're using regularly, they're having cravings, they're experiencing physical and emotional withdrawal when they try to stop, they're continuing to use despite the fact that they've had negative consequences, that's a pretty good indication that they have some level of dependence and might need some help in quitting. If they can say no to all of those things, maybe they're early on in their vaping and they need more education than anything. And I know in schools there are a couple of programs, like Vape-Educate is one for kids that need a little bit more education so that we can stop them from developing dependence. But for those who are already addicted, they're continuing to use even though they've maybe gotten in trouble a couple times, or they've tried to stop on their own and were not successful. We know that consequences can be a powerful motivator, but they're not enough. That's not enough for somebody that's addicted, as we know. So if they're going to change, anybody that's on here that's a therapist, or you're good at motivational interviewing, you know that the decision to change is up to the teen or the client in treatment. And what we can do as professionals is help to provide the motivation and the tools for when they're ready to quit. So once we help them to get committed and we help them to build confidence, then maybe they're going to be ready to start doing the incredibly hard work that comes with quitting. I know that young people double their chances of success in cessation when they do reach out for some sort of support group or online quitting tool. I know that within school systems and even virtually now, some programs are available to teens that are looking to quit. I know Caron's program is called Project Connect, and that's free for kids to take. And then we also have that online digital support for teens. And it's all about helping them to figure out their triggers, work with them on stress management, work with them on social skills and how they're going to handle being around their peers if they're not using. And then there's a lot of other free programs out there. The Truth Campaign has a text support quit app that a person can download. And there's many more out there. So I think the bottom line is a lot of these kids are going to need help. And even if they haven't been vaping that long, it's that powerfully addictive.
And I would just add to that.
Yeah, please do.
We see many young people who come in for treatment of another substance use disorder. Oftentimes it's cannabis and some alcohol. And the majority of those patients who come here do vape. Some of them smoke cigarettes, but many of them do vape. And the majority of them do decline a nicotine replacement treatment when they come in, thinking that they just don't need it. And many of them do demonstrate nicotine withdrawal symptoms once they've gotten into treatment. So I think no surprise that they underestimate how bad the dependence gets.
Right, and anyone that's ever been around someone that's trying to quit knows how difficult that can be for them. So patience, if you're a parent that's listening and your child is trying to quit, expect that they might be a little bit more irritable than you're used to. And you need to be a little bit mindful of that and cut them some slack. Project Connect and Connect 5 were the names of those support groups. And then the one from the Truth Campaign, I think is called Ditch Jewel, but you can Google it and look that up. So we have a couple of questions that have come in that we can get to now. Does the manufacturer not have to release what is in the ultrafine particles?
Well, that's a good question. I don't think the manufacturers discovered the ultrafine particles. I think they were discovered post-marketing. And nobody knows what's in them because they're so fine. They can't be studied, right? So I don't know if there have been any attempts by the FDA or any other regulators to say, hey, you have to build filters into these things to filter these particles out. But again, I think that if it was possible to identify what's in these ultrafine particles, then yeah, you'd have to, there would be a mandate that the manufacturers release. But again, these ultrafine particles are, they're in many different combustible products, or they're emitted by combustible products that we just don't know what's in them.
Okay. Are there secondhand smoking effects with vaping, like secondhand vape effects?
So the answer is almost certainly. Again, there have not been any controlled studies that I'm aware of that show secondhand vapor effects. Vapor is heavier than smoke, and it's one of the issues that we're talking about now in the COVID-19 spectrum is aerosols, right? Aerosols that are transmitted less than 6 feet. That's part of the reason why we adopt a 6-foot distancing. I'm sorry, less than 3 feet. So if you adopt 6-foot distancing between individuals, even if somebody coughs, right, the aerosol will only travel 3 feet. And so a person 6 feet away is safely protected. Aerosols, on the other hand, aerosols are lighter in weight and travel farther and get suspended in the air. So vape exhalant, right, what you exhale is mostly vapor. Tobacco exhalant is mostly aerosol. So tobacco has been studied, very easy to find secondhand smoke effects. Vapor is not so easily studied, and there have been some case reports of people in close association with vaping, people who developed some illness, some lung illness, but did not have themselves. So that, again, my answer is probably, but not supported by really high quality scientific studies.
Okay, okay. Hoping you know what this is referring to. Is the ground glass effect solely related to vitamin E acetate in vaping?
Yeah, no, it's not.
Okay.
Ground glass is just, it's a term we use for a type of pneumonia called interstitial pneumonia. It depends on where the pathology is, the infiltrate, et cetera, within the lung, right? If it's in between the lobules of the lung, it's called interstitial. If it's in the lobules of the lung, it's called lobar pneumonia. So it's a it's a radiographic distinction. The damage to the lungs caused by vaping, the E-volley causes a ground glass appearance, but somebody could certainly get ground glass appearance from a non-E-volley vaping-related pneumonia. So yeah, it's not specific for that.
Okay.
I know, you're getting into tech talk here, so I don't want to.
Yeah, it was a little over my head. No, that's great. Are you aware, so my world is more teens, but if we're talking about adults too, are you aware of any additional smoking cessation programs for vaping, not necessarily smoking?
No, not other than
Okay.
what you mentioned before. I think that I think the principles are the same, whether it's smoking or vaping. The idea for most people is to break that nicotine addiction, to withdraw from nicotine in the least bothersome way possible. Nicotine withdrawal is very difficult, and it's the reason why most people fail smoking cessation or vaping cessation. And nicotine withdrawal is best treated by a combination of nicotine replacement, whether that's a patch or chewing gum or lozenges or nicotine nasal spray or what have you, in addition to medication, oral medication, varenicline. But varenicline's not everybody can take varenicline. Not everybody's a candidate to take it. But even if you take both varenicline and a nicotine replacement therapy, you're still at a less than 50% chance of successful long-term quitting. So nicotine replacement plus varenicline when it's applicable, plus a support system is really the way to go. And even in those cases, it's difficult. There has to be an enormous incentive. Honestly, that's really the biggest predictor of who's going to succeed is how high is your incentive.
And how long does nicotine withdrawal tend to last, especially with teenagers?
Well, it's interesting. We would expect that nicotine withdrawal would last as long as the nicotine metabolites are in the system, which is about 2 weeks or so. But nicotine cravings last for months and months and months afterwards. I would say that it's very common to hear somebody saying 3 months after cessation of nicotine, they're still craving it. And even I've heard people say even years later, it'll be just a very brief period where they'll get a craving. But I would say the safe thing to say for teenagers is 3 months and you'll be feeling fine.
Right, and I guess some of it depends on how much and how often they were using, and the strength of what they were using. We're seeing a lot with kids now that they're moving away from products like Juul and more into the disposable products like Puff Bar because they have a lot more flavors available right now. There's been flavor bans put into place, limited ones on pod-based systems. Yeah. So kids that want something other than menthol or tobacco flavored are now tend to be going the route of these disposables. And they have a high nicotine concentration, and kids are really struggling with that. So I think, as they're going through that withdrawal process, the more that we can help to prepare them to know what to expect ahead of time, that you are likely going to have cravings and be irritable and tired and maybe feel hungry, and we can help them to develop a plan for how they're going to manage those things, probably the better off they're going to be. Another question that came in is vitamin B12 less harmful to the lungs than nicotine? Vitamin B12 ANN less harmful to, or does it have similar carcinogens? This might be a typo. Is that making sense?
Well, vitamin B12, I'm not aware of vitamin B12 being
any less harmful. Yeah.
Added to any vape products. I'm just not aware of that. Right. Now, vitamin B12 in general is a water-soluble vitamin, which is, many people take vitamin B12 by injection or by oral route or sublingually. In some cases, especially people who have had gastric bypass surgery will take it in different routes. But it's a water-soluble vitamin, which means that it's not going to get into the lungs and cause problems. Vitamin E is a lipid-soluble vitamin, which can cause problems in the pulmonary system. So I'm not aware of any B12 associated lung injury.
All right. It brings up an interesting point, though, that people are vaping a lot of different things. I mean, I've done presentations where You know, people have told me that they're allowing their kids to vape essential oils because they want them to fit in when they are with their peers, and they feel like that is safer. And I think we would all, you know, admit that you're supposed to have oxygen in your lungs, and anytime you're putting something else in there, you have the potential for it to cause some pretty bad side effects.
I would just say that, you know, the people and respiratory systems developed long after we had our atmosphere here. And to your point, you know, the reason why the respiratory system developed the way it did was because there was this stuff called air that could sustain life, and life developed to be dependent on air, right? So nice ideas, you want what's best for your child, and that's nice, but, you know, I just, it's hard for me to advocate for anything other than air for the lungs.
Right, right. And then there's a lot of questions just related to what supports are out there. And maybe when we send this PDF out, I can put together a list of some of those free programs that I was talking about before that are available for youth in particular. For adults, you tend to be able to use quit lines, and most of those right now have really picked up on it being inclusive of all tobacco products, and vaping is included under that umbrella. So, you know, hospital systems likely at this point, most support groups are still virtual, but it's certainly better than nothing. So I'm happy to put together a list that we can make available to everybody, just so that they know, because there is a lot of free support out there right now. So that's great. And lastly, there's one related to the legality of THC. So has vape containing THC been outlawed in the US nationwide, or is it still based on state law?
My understanding is that it's based on state law. It's very interesting because CBD products are available commercially for use in vape pens, but CBD products contain a certain percentage of THC, small percentage of THC, but it varies from state to state what the allowable amount of THC in a CBD product is. So that's been going on for a long period of time. My understanding when speaking to, and I'm not really as up on this as I would have been prior to COVID-19, I will tell you that, but when THC was first being discussed as being legalized, as heading for legalization within the state of Pennsylvania, they were talking exclusively oil, THC solution to be used in vaping products. And I don't know where that stands now. I think that it's a leaf product that is available out there, but I'm not sure. Excuse me. So I apologize, but that legal quagmire around THC products and what's legal and what's not, and what's going to be happening when THC, if and when THC is approved for recreational use. I'm just not familiar with all those details. What I know is that edibles are not going to be legalized in Pennsylvania. I'm pretty sure of that, but I'm not positive.
Okay. Yeah, bottom line is, regardless of the laws in whatever state that you live in, it's pretty easy to get your hands on any of this stuff very easily. So our time is wrapping up. So I really wanted to thank you, Dr. Drosnes. And as a reminder, we're offering continuing education credits for social workers. A survey will be posted for you to take immediately following this presentation in order to obtain your credits. And again, you must have been on for the duration of the presentation to get the credit. You will receive a certificate of completion in the next couple of weeks. And I really hope that you can join Caron next Tuesday for the next installment of this webinar series. We're going to welcome 2 of Caron's staff dietitians who will speak on the topic sobriety, nutrition, and COVID-19, practical ways to stay healthy and sober during a worldwide pandemic. Registration is open now for the webinar, and please watch your email for more details. And then also, I want to remind you guys to reach out to your local regional resource director for any additional information or questions. Thank you for joining, and we hope you have a great day.